So, can we talk a little bit about the correlation between diabetes and kidney disease?
So, as many people know, diabetes unfortunately can have a lot of different complications. So, we always refer to it as you can have small vessel involvement because of the blood sugars being elevated. It can damage the little blood vessels, and you can also have big blood vessels affected. So, when people have big blood vessels affected, they're at risk for getting heart disease, which we know people with diabetes are at way higher risk of having heart disease than someone who doesn't have diabetes. Similarly, the small blood vessels can get affected. So the eyes can get affected, where people will have problems with their eyes and they can require laser treatment of their eyes. The same small little blood vessels are in the kidney, and so therefore the same little blood vessels get affected with the diabetes. And so the better your diabetes is controlled, the less the high blood sugars are occurring, the less damage those little blood vessels will affect. So there's an absolute correlation with having diabetes and how well it's controlled, and how these organs that I mentioned and the kidney getting involved. So people with diabetes, if the kidneys start to get involved, usually the first signs is they start to leak protein in their urine. And that's why all diabetics should have routine screening of the urine for protein leakage, because that's the first sign that the kidneys are getting, that little blood vessels are starting to get damaged. And there's lots we can do to reduce that damage with good blood pressure control, making sure the sugars are well controlled, and implementing medications. So blood pressure medications like ACE inhibitors or angiotensin II receptor blockers specifically work in that area and reduce that pressure, reduce the protein leakage. The SGLT2 inhibitors, they reduce it. And now we know that medications such as Ozempic, which is used for diabetes, can also help with reducing that pressure as well, and hopefully reduce the protein leakage. So there's lots you can do. So that absolutely there's a correlation. It's important to screen early and start to do something about it early to prevent that damage from occurring.